All right, welcome back. Local on 2 is celebrating Wellness Wednesdays and helping you feel better by addressing a variety of topics. The latest numbers from the American Heart Association shows that cardiovascular disease is on the rise year by 10,000 more deaths in the previous year, this year, than in the past. But what if part of the prevention equation was related to hormones? Well, Sylvia Castaneda wanted to learn more, so she sat down with doctors from Inspire Medical Wellness in Mount Juliet and Evexia's Health Solutions to ask them how the latest information really works.
For many years, people believed hormone replacement therapy could put them at greater risk of developing heart disease. So let's talk about the facts. Back with us is Dr. Jason Burchard, owner of Inspire Medical Wellness in Mount Juliet, and Dr. Terry Denai, who is the founder of Evexia's Health Solutions. Dr. Denai, talk to us a little bit about history. Why did using hormone therapies become such a concern when it comes to heart disease for women?
Yeah, so, I'm going to try to just do the synopsis here. It's a long story. But in the 50s and 60s and 70s, we were seeing women that were on oral synthetic estrogen had much less incidence of heart disease. And so in the late 90s, we wanted to study that as a medical community, and hence the Women's Health Initiative trial was born. Unfortunately, what happened in that trial is women taking the oral form of estrogen with the synthetic progestin had higher rates of heart attacks and strokes. So again, just like the misinformation that was born in the breast cancer world, same thing in the heart disease world. What we now know is that estrogen only without the synthetic progestin is very, very protective to the heart.
Dr. Burchard, was it the same type of situation with men and heart disease and stroke, that same fear factor?
Well, I think there has been.
Yeah.
Fortunately, even cardiologists that we work with today are starting to really finally get a little bit more, I don't want to say on board, but just I think up to date with the fact that testosterone is so protective to the heart. I mean, it's been shown to be a vasodilator, so it increases healthy blood flow. It's a very important for our endothelial cells. So it's just so protective to the heart that there's if anything, again, we like to have the conversation of it's another reason to do the therapy.
Right.
So you dispel that and make people understand
Absolutely.
That is fact.
Yes.
Perfect. So then, Dr. Denai, how do menopausal hormones then reduce the risk of heart disease for women? How does that help?
Well, especially if they're taking all three hormones that our body makes, estrogen, testosterone, and progesterone, these hormones work synergistically or work together to protect the heart. Now, like he said, testosterone is a vasodilator. Estrogen is powerfully anti-inflammatory, and it's what we call an immunomodulator. And so, cardiovascular disease is a disease of inflammation. So you have testosterone, which dilates the vessels and also addresses inflammation. You have estrogen, which also addresses inflammation, among other things. And it works at the cellular level of the heart to improve that tissue, like he said, to prevent the disease.
But talk to me specifically about testosterone. What do you tell men? Because, men sometimes are afraid of jumping in and discussing this.
Right.
Well, I think, again, just having the conversation of the importance of being tested. I mean, it all starts with the proper health history and proper blood work to look at these hormones. If they are suboptimal, then we're really going to educate and inform them on, as we've both been saying, the importance not only in how it improves your quality of life. I think more and more people, again, understand that part. But the most important part of the therapy, I tell men all the time, you're going to feel better. But the most important part of staying on the therapy is it's preventative.
Right.
It's going to continue to protect, again, your brain. It's going to protect your prostate. It's going to protect your bones, and it's going to protect your heart.
Yep.
And the way that you all approach this is personalized.
Yes, very much so. Very personalized medicine, and coming in, get a full lab panel and sitting down and talking about your health history, your family history, and really what the goals are for the individual patient and creating a treatment plan.
Yep. And that's something patients should feel good about coming to see you, knowing that you're taking that personal approach.
Yes, absolutely.
Well, doctors, thank you so much for coming back and educating us about this very important subject that impacts all of us.
Yeah, thank you.
I'm going to send it back to you.
Thank you, Sylvia. To learn more about hormone replacement therapy and its benefits, or to make an appointment, visit inspiremedicalsolutions.com, or you can visit Evexias.com and then click Find a Provider.